I've entered the room and checking to see if it's safe for you to approach. Hello, Mel.
Hi.
Hiya, it's Mel again. Do you remember me?
Yes.
Hello. So I've come to give you your medication, if that's okay.
Yeah, that's
Is
fine.
that right? I've just got to do a few checks though. I know we went through this earlier on, but just to check that everything is correct. Is that okay?
Yeah, okay.
Lovely. So Malcolm, can you please let me know what your full name is, please?
Malcolm Jones,
Lovely. And can you tell me your first line of your address?
2 Pretty View,
And also, can you give me your date of birth?
5th of May 1956.
Lovely. And your hospital number is 654321. I can confirm all those details are correct. And also, can you tell me, are you allergic to anything?
Yeah, I'm allergic to paracetamol
Mhm.
and eggs.
Okay. So I've got an allergy label here saying that you are allergic to paracetamol and eggs. And can I just ask again, what happens when you take paracetamol?
I get a really swollen face and blocked airway and that kind of thing.
Okay.
Quite serious.
Right. Okay. And then also with eggs, so just clarify what happens when you take
Oh, they
eggs.
just make you feel sick.
Okay, that's lovely. That's all presently correct on this chart here. So, Mal, what I'm going to do, I'm going to go through your drug chart with you, if that's all right, and then just see what medication we're due to give you now. Is that okay?
Yeah, okay, thank you.
Yeah, and how are you feeling at the moment?
A little bit better now, more comfortable.
Good. Okay, lovely. Okay, that's great to hear. Okay, right, I'll be with you now. Palm to palm, back of the hand, interlacing, interlock, fingertips, thumbs and wrists. Okay. So I've got my medications trolley here. Okay, so I'm just going to read out to you, Malcolm, okay, if that's all right. I'll just read the chart out to you so you know what we're going to be giving you, okay?
Yeah.
Okay, so I'm just checking my prescription charts. It is for Malcolm Jones of 2 Pretty View Hillside, hospital number 654321 and date of birth is 5th of May 1956. Admission date is today. It's quite clear that ward is Ganini ward. Allergies are documented. We've got paracetamol to say, and it's anaphylaxis and gets angioedema. And then eggs, the type of action is nausea and vomiting. It's signed by the prescriber and dated for today. There's information for prescribers and information for administering medication on the chart. Does the patient have any documented allergies? Yes, we have, and we've established that correctly. Moving forward, on the following page, we've got its correct address graph for Malcolm Jones, hospital number 654321, address 2 Pretty View, date of birth 5th of May 1956, male. Consultant is present and correct here. Can I just check with you, Mal? Have you got any dietary needs?
Yeah.
Okay, that's lovely, thank you. I'll document on that. So we're moving on to our once only and stat dose medications. So Malcolm, today you were given, this morning, you were given some Oromorph analgesia. Do you remember that, like a liquid morphine?
medicine.
Yes.
Yeah, I remember.
Okay. So just check with that. You had that about half an hour ago. Can I just ask you, what is that? What on a pain score between 0 and 10? What's your pain score like now?
I'd say about a 2 now.
Oh, so. And what was it previously, before my colleague gave it to you?
I think I said 7. That's
Oh,
right.
oh, that's a lot better. Oh, that's great to hear. Okay, that's fantastic. That's working as effectively as it should be. That's brilliant. Okay, moving forward, we've got today's date. For today, time required at 2 o'clock morphine. That's to be given at 2 o'clock, so I won't be giving you that now, okay? That's 5 milligrams. Prescriber's signature, I believe it was correct. As I say, I won't be giving you that because that's not due till 2 o'clock this afternoon, okay?
Okay.
Then it says about, does the patient have any documented allergies? It's actually documented no, but of course we've established that you have got allergies, and I'll get that rectified with that. On the following page, we've got, there's no address or graph details there, so I'll have to get that rectified with the patient's full address, date of birth on there. I'll ask the prescriber to do that. We've also got about oxygen, target oxygen saturation 94 to 98%. It's a PRN therapy until target saturation is achieved, and device to be used simple face mask, prescriber signatures there, present and correct, and bleep number. Examiner, can I just check, what's my patient's oxygen saturation level, please?
99% from the area, I've got 7.
Okay, lovely. So there isn't, it's not clinically indicated to give that oxygen to you now, Malcolm, okay?
Okay.
Moving on, we've got PRN as required medications. For today, drug Oromorph, dose 5 to 10 milligrams, root oral, it's 4 hourly. Prescriber's bleep number and signature is present and correct. As I say, I've just established with you now, Malcolm, that your pain is a lot better. As I say, an Oromorph, we gave you that at 7:30, so of course I wouldn't be able to give you that now because it's only like 8 o'clock in the morning now, so of course wouldn't be able to do that, but as you say, your pain is much improved, so that's great. Then we've got today's date today, drug paracetamol, 1 gram, root oral, instructions 4 to 6 hourly, maximum 4 grams for 24 hours. Prescriber's bleep number and signature is present and correct. However, I can't give you this paracetamol, Malcolm, because I say you've got an allergy to paracetamol. So I'll speak to the prescriber and I'll get that rectified, remove that off your drug chart, okay?
Okay.
And then we've got, for today's date as well, a GTN spray, glycerin trinitrate spray, 1 to 2 sprays, sublingually as required. Prescriber's bleep number and signature is present and correct. Can I just check with you, have you got any chest pain at all, Malcolm?
No, not at the moment.
Okay, lovely. So if you do experience any chest pain, if you let us know, we can always give you something to alleviate that pain, okay?
Okay.
Okay. Moving forward onto the next page, we've got a dressograph for Malcolm Jones, 2 Pretty View, Hillside. Hospital number 654321. Date of birth is 5th of May 1956. Does the patient have any documented allergies? Clearly stated yes, and we've clarified that as I say earlier. Antimicrobials are being prescribed, amoxicillin. Today's date, dose 500 milligrams, frequency TDS, root oral, duration 5 days. There's a start date for tomorrow. Prescriber's signature is present and correct in the bleep number. As I say, you've been prescribed some antibiotics, Malcolm, but it's not due to start until tomorrow, okay? So when we're with you tomorrow, we can give you those medications then, okay?
Yeah, lovely.
There is no further antimicrobials on this chart. Moving forward, on this next page, we've got regular medications for Malcolm. It's a full addressograph, Malcolm Jones, address 2 Pretty View, Hillside, hospital number 654321. Date of birth is 5th of May 1956. Does the patient have any documented allergies? Yes. Regular medications, we've got aspirin. For today's date, dose 75 milligrams, frequency daily, root oral, duration continuous, start date is today, prescriber signature and bleep number is present and correct, and the due time is for 8 o'clock this morning. So I understand, Malcolm, you take aspirin, you've been taking aspirin at home?
Yeah, I used to take one in the morning.
Okay, so I understand, so you are nil by mouth, aren't you, going to theatre, as we spoke about with you earlier on. So the plan is we wouldn't be giving you the aspirin now. As you know, it's a blood thinner, but also the risk is sort of with that because you're not eating and drinking at the moment, and the risk of that. Is that okay?
Yeah.
So we won't be giving that aspirin, as I say, and then when when you come out of your surgery and you're back on the ward, you're eating and drinking, we can restart that aspirin.
Okay.
All right? Okay. Then the next medication we've got is atenolol. Today's date. Dose 50 milligrams, frequency daily, root oral, duration continuous. It's due at 8 o'clock this morning. This is a beta blocker, and this is for use for patients to maintain that patient's blood pressure. Can I just check it, Zana? Can you tell me what the blood pressure is for Malcolm, please?
Blood pressure currently is 130/5.
Okay. So Malcolm, I'll be able to give you that medication because your blood pressure is within normal limits, so I can give you that. Is that okay?
Yeah.
So I'll be giving you the atenolol, and then moving forward, there's no prescription there moving forward. We've got for intravenous fluid therapy prescription, Malcolm Jones, 2 Pretty View, hospital number 654321, date of birth 5th of May 1956. Does the patient have any documented allergies? It's not actually circled, but we know the patient is allergic to paracetamol and to eggs, so I'll document that accordingly. And there's no intravenous fluid therapy prescribed. Okay. So the medications I'll be giving you then, Malcolm, is just the atenolol.
Okay.
So I know you're going to theatre.
Yeah.
So basically, we'd like you to have it with just the minimum amount of water, so no more than 30 mils of water.
Okay.
Okay. Mm-hmm. So I'll give you that one medication. All right.
Yeah. Sure.
Okay. So with atenolol. So we've got atenolol 50 milligrams, expires July 2022. The bottle is intact and it's not been contaminated. And a medicine pot. So it's 50 milligrams and the due dose is 50 milligrams. So that is one tablet. And I'll get some water. Okay, can I just check if you've got any swallowing problems at all, any difficulty in swallowing?
No, I'm fine, thank you.
Okay, so with this medication, as I say, you know you're on it sort of long term with this and it's for your hypertension. So just making sure with that, as I say, we'll take that with a little bit of water, no more than 30 ml if that's okay.
Yeah.
All right, so if I just give you this, okay? Okay, so there's your tablet. Okay, there's your water. Okay, just checking, is that all gone? Yeah, okay, that's lovely, thank you. So Malcolm, can I get you anything else?
No, thank you.
No? Okay.
No, comfortable.
All right, so what I'm going to do, I'm just going to document what I've given you and the reasons why I'm not giving you the medication as well, okay?
Okay.
Is that all right?
Yeah.
Okay. So I've signed for the atenolol, but I've given that to Malcolm. I've put the drugs not administered and the aspirin because the patient is nil by mouth. I'm also going to speak to the prescriber because, say, the paracetamol is being prescribed and the patient is allergic to that, so I'll rectify that with the prescriber to get that admitted from the chart. Okay, so I've signed for everything. Malcolm, I've signed you for your medication. Are you quite comfortable there now?
Yeah, thank you.
Okay, lovely. So what I'll do, I'm just going to leave you now, all right?
Okay.
As I say, I've left the call bell there if you need anything, and so you're going to surgery this afternoon anyway, aren't they? But if the pain sort of comes back, just let me know and I can get you some alternative analgesic for that.
Okay, thank you.
Is that all right?
Yeah.
Okay, I'll be back to you later, Malcolm.
Lovely.
Okay, thank you. So I'm going to try to my trolley away for the next juice.